Hello, my name is Patricia Chadville, and I'm here today to talk to you about mental illness awareness. It was in the winter of 2013. A child walked into their parents' home unannounced to find the mother very depressed, crying, screaming, and there was not anything that the child can do to console that mother. The mother was screaming, didn't know who the child was, and wanted the child out of her home immediately, threatened to call the police. So the child let the mother call the police. The police came, and after much evaluation, they then called the ambulance. Ambulance picked up the mother. Mother was brought to the hospital. After evaluation, the hospital doctors and nurses had her admitted into the psychiatric ward. Once she was in the psychiatric ward for several days, she was then released, but not to go home. She was released into rehabilitation, stayed in rehabilitation for a month, was then released to go home. However, home was not her home. Home was at the child's home. After about a month, the incident started to happen again, where the mother was out of sorts. She was then brought back to the hospital, put back into rehabilitation, released after 10 days. However, this time, she could no longer go home or no longer go to the child's home unless someone would be there with her 24/7. She could not be alone because of her psychiatric issues. It was not just depression, it was also psychiatric and other issues that she encountered. She is now in a nursing home, being well taken care of. That mother is my mother, and yes, I am the child. This is why today I would like to speak to you about awareness of mental illness. So I ask you to listen with an open heart and an open mind so that we can discuss some problems and causes of mental illnesses. Let's also look at developing a plan that will assist individuals with mental illness. When we look at the statistics, according to the National Mental Illness Awareness site, approximately 18.5%, which is 1 in 5 adults, experience mental illness within 1 year. Approximately 4.2%, which is 1 in 25 adults, experience a serious mental illness in a given year that interferes or limits one or more major life activities. Approximately 1 in 5 youth between the ages of 13 to 18 experience a severe mental disorder at some point during their life. For children aged 8 to 15, the estimate is about 13%. 1.1% of adults in the United States live with schizophrenia. 2.6% of adults in the United States live with bipolar disorder. 6.9% of adults in the United States had at least one major depression episode in the past year. 18.1% of the adults in the United States experience an anxiety disorder. And among 20.2 million adults in the United States who experience a substance use disorder, 50.5% of those adults had a co-occurring mental illness. With that being said, some of the causes that is involved with mental illness is diabetes, chronic disease such as heart problems, obesity, asthma, epilepsy, and cancer. Mental illness is also associated with lower use of medical care, reduced adherence to treatment therapies for chronic diseases, and higher risk of adverse health outcomes. Many people suffer from more than one mental disorder at any given time. Nearly half, which is 45%, of those with any mental disorder meet the criteria for 2 or more disorders, with severity strongly related to these disorders. Many mental disorders were one of the 5 most commonly conditions in the United States in 2006, with expenditures at about $57.5 billion. Over 8.9 million persons have co-hearing disorders. That is, they have mental and substance use disorder. With all experience emotional ups and downs from time to time caused by events in our lives. Mental health conditions go beyond these emotional reactions and become something stronger. They are mental conditions that cause changes in how we think and feel and our mood. They are not the result of a personal weakness or lack of character or poor upbringing. With proper treatment, people can realize their full potential, cope with the stresses of life, work productivity, and make meaningful contributions to the world. Without mental health, we cannot be fully healthy. But understanding mental health isn't only about being able to identify symptoms of having a name of these conditions. This is very complicated, especially in our communities. The federal government, research institutions, private companies, and other pieces that are all trying to fit together. Each piece contributes to our understanding of mental health. If one is missing, the picture is never complete. Trying to tell the difference between what expected behaviors are and what might be the signs of a mental illness isn't always easy. There's no easy test that can let someone know if there is mental illness or if actions and thoughts might be typical behaviors of mental illness. Each illness has its own set of symptoms, but some common signs of mental illness in adults and adolescents can include the following: excessive worrying or fear, feeling very sad, confused thinking, confused on problems, lack of concentration, irritability or anger, sleep pattern changes, feeling very tired, delusions, hallucinations, in which a person's experience and sense things that cannot exist. Abuse of substance or alcohol are also some signs. Multiple physical ailments without obvious causes, such as headaches, stomach aches, vague and ongoing aches and pains. Mental health conditions can also begin to develop in young children because they're still learning how to identify and talk about their thoughts and emotions. Their most obvious symptoms are behavior problems. Symptoms in children may include changes in school performance, excessive worry or anxiety. For instance, fighting to avoid bed, or school, and very frequent nightmares and frequent disobedience or aggression. So some of the plans that we have to put in place that will help individuals with mental illness is pretty much already in place. We have to take that extra step as an individual to make sure that if we notice an individual has issues, we help them get to the right facilities to help them adjust their medicine and to be well taken care of. So innovations in the range of evidence-based medication, therapy, and psychology services such as psychiatric rehabilitation, housing, employment, and peer support have made wellness and recovery a reality for people living with mental health conditions. Choosing the right mix of treatments and support that work for you is an important step in a recovery process. When a person is directly involved in their treatment, they may reject treatment. This is why it is very important for them to get to a doctor or a nurse once you or an individual has noticed there's some signs, because that doctor, that nurse can enforce treatment is taken in the right direction. I know this is a lot to retain, but just think about what you as a person can do to prevent an individual from harming themselves or even others. Remember that suicide is the 10th leading cause of death in the United States. According to the National Alliance Mental Illness website, 90% of these suicides are due to untreatable mental disorders. So I ask you to be conscious and not judgmental of individuals with mental illness. You may be the individual that saves a life today. Remember my mother? What may have happened to that vibrant young woman had I not walked into her home unannounced on that very day in winter 2013?